I'm Dr. David Lamb. I'm a cardiologist at Swedish Heart and Vascular Institute. Cardiology is a very exciting field. Cardiology allows us to really make a difference in people's lives. On a day-to-day basis, I do a lot of different things. I do a lot of consultations. Consultations are where I can learn about the patient, really learn about their background, learn about their values. And a lot of what I do on a day-to-day basis is trying to figure out why folks are experiencing the symptoms they might be having and whether they are related to the heart. Some of the most common things I see are chest pain, shortness of breath, irregular heartbeats, and my job is to work with the patient to use a lot of the tools we have in cardiology to try to come up with a diagnosis to figure out what's going on and see if there is a heart problem that can be treated and addressed. When I'm seeing a patient for the first time, I do a lot of research before I walk into the patient's room. And by the time I see someone in the clinic, usually they have already seen a primary care doctor for a heart-related concern, or they may have been in the emergency room recently. And I try to learn as much as I can about what happened to them, where they're coming from, what testing they may have already had, and I try to piece together as much as I can before I walk into the patient's room. That way, when I'm seeing the patient for the first time, I'm really trying to get a picture of what's going on. We have a state-of-the-art facility here at Swedish Heart and Vascular Institute, and that really makes a difference because it allows us to use all the tools we currently have in cardiology. Even in the past 10 to 15 years, the field has changed quite a lot. We have a lot of minimally invasive techniques these days. We have ways to diagnose heart problems that we previously did not. And the technology has really progressed rapidly, which is very exciting for us because we're constantly having new treatments for patients, new things to do, things that are less invasive, that are quicker, that are faster, that get patients feeling better and out of the hospital sooner. So to me, that's very rewarding because cardiology is a field that is changing a lot, and also there is a lot of exciting research. We have a lot of clinical trials going on at Swedish Heart and Vascular, and I would say that we're very cutting edge because we really have all the subspecialties within cardiology.